There are many parts of spring 2020 that people remember. Schools and businesses shutting down and trying to figure out how to work from home. However, there are also people that probably remind you of that time. For Ohioans, that person could be Dr. Amy Acton, the former state health director, someone who helped lead the response, who is now running for governor, and someone we wanted to sit down with.
It's sort of like a hurricane that's moving toward us.
From day one,
We know these will be our hot spots.
as weeks seem to blend together,
Life seems like it's shutting down.
Dr. Amy Acton was a daily figure in the uncertainty of the COVID-19 pandemic.
Dr. Acton.
Yes, thank you, Governor. Good afternoon, everyone. Happy Monday.
For months, she and Governor DeWine were the voices, leading Ohioans through the start of a dark era.
We actually started building a response in January. And we did a massive tabletop exercise with all of government in very early February.
With the first global health pandemic in more than 100 years, where do you even start?
George W. Bush made the first pandemic playbook. He made it right after 9/11, when they recognized that a pandemic or a biologic weapon were the greatest security risks to this country.
Dr. Acton says many of the state orders that were put into effect were from that playbook.
Everything was collapsing anyways. Schools were closing anyways because you couldn't have cafeteria workers, you couldn't have bus drivers. All of these things that we were facing were going to happen, but they might have happened just in chaos. So the orders were a way to help us all row together.
Those orders restricted gatherings, closed businesses, schools, and pretty much the whole state. Moves, Dr. Acton says, were the only option.
In the beginning of COVID, the mortality rate in March of 2020, if you went in the ICU, you had an over 50% chance in large parts of our country of dying. By June, that mortality rate had fallen to 5. So, you don't want to throw that throttle. You don't have to pull that lever, but you do it when you absolutely have to save lives.
But that lever would spark rage. Protesters gathered not just at the State House, but outside Dr. Acton's house. It would be June 2020. Dr. Acton stepped down, leaving her position following those protests. However, she says that is not the reason she made the choice.
I actually stepped down because special interest in the State House, the Speaker of the House particularly, was wanting orders that weren't science-based, could actually hurt people. And one of the hardest decisions I've made, one I would always make again, is I told the governor, I'll keep advising you, but I can't sign my name to these orders because I knew they would hurt people, potentially kill people.
While she faced criticism for her orders, there were some who saw her as a hero.
Hi, my name is Amy Acton.
After her departure from Columbus, Dr. Acton says she was still involved behind the scenes, helping lead 11.7 million people.
There's nothing more motivating than not wanting your people to suffer or die. And it's a privilege to be in that position. It gives you an energy, obviously, that keeps you going. And I would do it 1,000,000 times over.
Dr. Acton is looking to make big decisions for the state again, running for governor in 2026 as a Democrat. We reached out to Governor DeWine for comment on how he felt the handling of the pandemic went, but his office declined.